We're now honored to be joined once again by Dr. Richard Besser, President and CEO of the Robert Wood Johnson Foundation. Dr. Besser is also the former acting head of the CDC. Good to see you, Doctor.
Good to be here, Steve. Thanks for having me on.
You got it. Hey, listen, we're taping in February, 7th of February, being seen later. You've never tried to predict the future because you're a very smart man. Question, if I were to ask you where you think we're going with this 2 years in plus when it's seen, where do you think?
You know, you're right. I try to avoid predicting what happens here, but I do think we're entering a new phase of this, and the reason for that is that because of how contagious the Omicron variant was and the way it spread across the country, I think that most people in our country will have some level of protection around what comes next, and I think there will be things that come next. But my hope is that with each return of the COVID virus, with each subsequent wave, the impact will be less, and we're going to need to disrupt our lives less, and we'll see less in the way of hospitalizations and death. You know, that's my hope, that this is the way into COVID becoming something we live with rather than something we protect ourselves so dramatically against. But that's one of several possible scenarios. I think it's the most likely.
Absolutely. And one of the things, Dr. Besser, one of the areas we focused on in our coverage, and by the way, the Robert Wood Johnson Foundation is, in fact, a supporter of what we do in terms of our public health and educational programming. I want to be clear on something. One of the areas we focused on heavily is racial equity, social justice. There's a Rutgers Equity Alliance for Community Health that you and the foundation are very much involved in. One of our trustees, Micheline Davis, very involved as well. What is that, and what does it have to do with racial and social justice as it relates to this pandemic?
Yeah, when you look at the impact of this pandemic on our nation, there's not a single community that hasn't been hit by this and hit hard. It's hard to find anyone that you know who hasn't lost somebody, a friend, a relative. But when you look at the impact of this pandemic by community, when you look by race, by ethnicity, by income, you see differences. And in particular, in the first year and a half of this pandemic, Black communities, Latino communities, rural communities, lower income communities were hit far harder than other communities. There's recent data looking at the overall impact on longevity in America. And it dropped life expectancy for the average American by 1.6 years. But if you break that down by race, Black and Latino Americans lost 3 years of life, twice that of white Americans. So everyone's been hit hard, but clearly there are disparities in terms of who's been hit the hardest. The project that you lifted up at Rutgers is something that we're very proud about. And what it is it's a desire to work with communities to address the problems that people in communities see. And so it's bringing the expertise, the intellect, the research skills of our state university to our communities and saying, what is it that's challenging you most? Let's work together to solve that. Rather than coming in from above and saying, we know best, saying, no, you know what the solutions are, let's help achieve those.
Dr. Besser, let me ask you this. You're the former head of the CDC, and I'm a student of communication, a student of trying to communicate clear, effective, credible information. How difficult is it for Dr. Walensky, who is the head of the CDC as we speak? It's not really about her, it's about that position. How difficult is it to communicate accurate, credible information with such a moving, complex, unpredictable, dare I say, target?
Yeah, I think, Stephen, in the best of circumstances, it's incredibly hard. When you come into a position like that and the nation is already polarized, you come into a position like that and there's already massive distrust of public health at the federal, state, and local levels, where public health many times has been lifted up as the enemy, and you're trying to then engender trust. I don't know how you do that and are successful. It's just a monumental task. What I've seen with Dr. Walensky that I really appreciate is that she explains why she's making the decisions that she is, why the CDC is making the recommendations it is. And that's hard. That's hard to understand because
and it changes. I'm sorry for interrupting. Go ahead, I'm sorry. But it does change. And people say, wait a minute, if you want me to do what you follow the CDC, follow the science, and then 2 weeks later, a month later, it changes, how am I supposed to follow it? You say.
Yeah, the science has changed. We've learned something. So, that's one of the hardest things when you're faced with a new public health threat, is that the science is constantly changing. You're learning more. Right now, our governor is saying that in a month, school mask mandates can come off. Well, it's really important that that's framed in terms of because of what's going on right now, because the numbers are going down. And if we see that change, we may need to come back to you and say, here they are again. Whenever we're removing a public health measure, we have to frame it in the context of we're doing it because of this. And if that changes, we're going to come back and give you the best protection. And that may be that we put these right back in place. You want to set the stage for that because we've seen time and time again during this pandemic that things that have been lifted have had to be reimposed. And people get really, they get annoyed, they get angry, and they lose trust.
And so we're taping on the 7th of February. Say this is seen in April, May. We don't know what it's going to be, but as of now, and I'm going to ask you this real quick before we have to go. Dr. Besser, the polarization you described, the vehement opposition to government mandates about vaccines, masks, et cetera. Do you believe that those who have gotten the vaccine as we speak today will be those who get the vaccine, and this is pretty much it? That those who are resisting, they've resisted?
Yes and no. So I think that's true for hardcore people who have said absolutely not. But right now, what we're seeing in America is a much lower uptake in terms of boosters than in other nations. And I think there's a big group. There's something like 45% of people over 65 have not yet had a booster shot. We know that helps reduce the risk of hospitalization and death. And I think there's room there if we do more outreach to the elderly to get that number much higher, because that's a group that has already accepted vaccines that really should be getting these boosters to further give themselves further protection.
That is Dr. Richard Besser. He's the president of the Robert Wood Johnson Foundation and the former acting director of the Centers for Disease Control, the CDC. Dr. Besser, as always, thank you very much. We learn every time you're with us. We appreciate it.
Thanks for having me on. It's a real pleasure.
You got it. I'm Steve Adubato. That is Dr. Besser. We'll see you next time.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the New Jersey Economic Development Authority, Holy Name, NJM Insurance Group, Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Education Association, PNC, Grow Up Great, Georgian Court University, MD Advantage Insurance Company, and by New Jersey Sharing Network. Promotional support provided by NJ.com and by ROINJ.
Data shows that many patients have avoided seeking critical health care in the wake of COVID-19 for fear of contracting the virus. Delaying medical care can have serious consequences, so you should never second guess or ignore your symptoms. At Holy Name Medical Center, we have measures in place to prevent infectious disease from spreading. We're clean, we're open, and we're safe for all your healthcare needs.